One of the greatest satisfactions for a healthcare provider is seeing a healthy mother and baby. Pregnancy is a crucial time for information, support, and intervention to help women have the healthiest babies possible. As a healthcare provider, your assessment and guidance can make an enormous difference for the mother, her baby, her family, and your community. There are many serious prenatal issues that healthcare providers need to address. You can positively influence alcohol use in pregnancy through appropriate screening, care, support, and referrals. Alcohol use during pregnancy can have significant long-term consequences for the baby, including developmental delay, brain damage, and birth defects. Approximately 1 in every 100 babies is born with fetal alcohol spectrum disorder, an umbrella term used to describe the range of harm caused by prenatal alcohol exposure. There is no known safe amount of alcohol in pregnancy. Pregnant women who binge drink or drink heavily are at higher risk for poor outcomes. This video will help you identify effective ways to screen for alcohol use in pregnancy. Healthcare providers and service providers who work closely with pregnant women can make a difference. Alcohol use in pregnancy is a concern for all women. Screen all women for alcohol use, especially women who are pregnant or planning a pregnancy. Ask about alcohol often, as it may take time to build trust. In the next section of the video, you will observe healthcare providers screening pregnant women for alcohol use. Think about what they are doing well and what they could do differently.
Melissa, you don't drink, do you?
No, of course not.
You don't smoke either, do you?
How much alcohol do you drink, Rowena?
Not very much, just a bit on the weekends.
Oh, that's good. Alcohol can be harmful to your baby, and it's best to avoid drinking alcohol during your pregnancy. I have some information here about alcohol and pregnancy for you.
Thanks.
Okay.
Carol, how much alcohol do you drink?
Well, I like to go out with my friends and drink, but I stopped drinking once I found out I was pregnant.
I'm glad you stopped once you found out you were pregnant. That will help your baby. From now on, it's best for you and your baby not to drink alcohol.
How much alcohol do you drink?
A bit, I guess.
What do you drink? Beer, wine?
Whatever's available. Beer mostly.
How much would that be? A drink a day? A few drinks a day? One standard drink is a bottle of beer.
Like I count.
So on the weekend, would you drink 2 cases of beer?
No, 1 case of beer. 2 4-size. Why? Now that I'm pregnant, you think I should cut back a bit?
Your drinking has already harmed your baby. If you loved your baby, you'd stop drinking.
Rowena is a researcher in a university science department. She's 36 years old and is 6 weeks pregnant. Rowena has been married for 7 years. She jogs 2 miles a day and does not smoke. In the fall and winter semesters, she works about 50 hours a week. She has been trying to get pregnant for a year and is delighted with the prospect of having a baby. She has been taking prenatal vitamins, including folic acid.
So, Rowena, you're about 6 weeks pregnant, and things are going well?
Yes, I'm really happy. And I don't want to say anything at work yet, as it's too early. I might have a chance for promotion, and I don't want to miss it.
Yeah, I can understand that. I have a series of health questions that I ask all pregnant women about nutrition, exercise, that kind of thing, Rowena. Let me start with alcohol use. How much alcohol do you drink?
I drink a few glasses of wine socially once a week. Sometimes I drink at faculty functions, sometimes I drink with my friends, but I rarely have more than 5 glasses a night.
Do you drink in between these social events?
In the evening, after a busy day, I usually have a few drinks to relax. There is a lot of pressure at work right now.
You mentioned you have a few drinks to relax. How many drinks does it take to make you feel high?
I feel more relaxed after about 3 drinks, but I don't really feel high.
Has anyone ever annoyed you by criticizing your drinking?
Not usually, but I don't drink any more than my friends or colleagues. Right now, no one at work knows that I'm pregnant, so it would look really strange if I suddenly stopped drinking.
Have you ever felt you should cut down your drinking?
No, I can handle my alcohol.
Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover?
No, I don't drink that much alcohol. I don't drink to get drunk, just to relax. But now that I'm pregnant, I'm wondering about the baby.
Based on your history, Rowena, I am concerned about your level of alcohol use. This is something we can work on together. And there is a lot that you can do now to help your baby. To get you started, here are some answers to some questions about alcohol during your pregnancy that you might want to consider. Okay.
Monica is 22 years old and has no current health concerns. She is single, unemployed, and living on social assistance. She thinks she is about 18 weeks pregnant and has just started prenatal care. The pregnancy was not expected. However, Monica appears reconciled to the idea of parenthood. Because money is tight, it is hard for her to buy the healthy food recommended for her pregnancy, especially milk, fruit, and vegetables. Monica acknowledges that she smokes a pack a day and has been trying to cut down since she suspected she was pregnant. She does not take any drugs or medications. An estimate of her pre-pregnant weight shows that she has gained 5 pounds during her pregnancy.
So how are things going, Monica?
Okay, I guess.
Any problems or concerns about your pregnancy so far?
No, I think everything's fine.
That's good. I have some health questions that I ask all pregnant women. I'll start with alcohol. How much alcohol do you drink?
Well, I like to go out drinking with my friends, and I have about 4 or 5 beers, I guess.
How often do you go out with your friends?
Well, definitely on the weekend.
So once a week? More often?
Oh, a few times a week. And a bit more if I'm having a bad day.
So Monica, tell me what a bad day looks like.
Well, if I'm getting lonely or if I'm bored, and if I start worrying about how I'm going to take care of the baby, I'll drink a few more to feel better.
So how many drinks does it take to make you feel high?
Oh, I start to feel pretty good after about 3 beers.
Has anyone ever annoyed you by criticizing your drinking?
I don't have a drinking problem, but my friends have started to bug me about cutting down.
Have you ever felt that you should cut down your drinking?
No, I can quit if I want to. I don't have a problem.
Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover?
Yeah, sometimes, of course.
Monica, based on your history, I'm concerned about the possible effects of alcohol on you and your baby. This is something we could talk about more. I'm pleased to hear that you're already doing things to have a healthier pregnancy and a healthier baby, such as cutting down your smoking and keeping your prenatal appointments. I have some information of a local program that gives out vitamins and gift certificates for milk.
Thanks.
You don't smoke either, do you?
How you ask about alcohol and pregnancy makes a difference. Ask often. Ask in a non-judgmental way. Use open-ended questions. Start by asking, how much alcohol do you drink? Find out about frequency and quantity. Use the T-ACE screening tool. T-ACE is a 4-item questionnaire to assess pregnant women for risk drinking. It does not predict the likelihood of having a baby with problems due to prenatal alcohol exposure. The T-ACE questions are: how many drinks does it take to make you feel high? Score 2 for more than 2 drinks, and 0 for 1 or 2 drinks. Has anyone ever annoyed you by criticizing your drinking? Score 1 if yes. Have you ever felt you should cut down your drinking? Score 1 if yes. Have you ever had a drink first thing in the morning to steady your nerves or get rid of a hangover? Score 1 if yes. If the pregnant woman does not drink alcohol, reinforce that this is a healthy choice. If the pregnant woman does drink alcohol, advise that it is safest to stop drinking. Advise women unable to stop drinking to reduce drinking. Advise by providing personalized feedback and information. Assist through referral to appropriate resources. Assist through continued follow-up and support. A T-ACE score of 2 to 5 indicates possible at-risk drinking and the need for further assessment. Assess readiness and ability to stop drinking. Assess level of alcohol dependence and arrange for medical detoxification. If a woman is currently drinking alcohol or drank alcohol earlier in her pregnancy, encourage her to call Mother Risk for a confidential discussion about possible risks to the baby and information about alcohol counseling, treatment, and prenatal support programs. Mother Risk counselors are available Monday through Friday from 9 a.m. to 5 p.m. Your patient is welcome to call as often as she likes. The number is 1-877-FAS-INFO. Healthcare providers can call Mother Risk if they have questions about alcohol use in pregnancy, or if they want to know about local counseling, treatment, and prenatal support programs. When addressing alcohol use in pregnancy,